Hey everyone, hi and welcome to Aarohan Coaching Institute. Today we are going to discuss a report published by the World Health Organization, shortly WHO. In the report, WHO highlights that neglecting of oral health has affected nearly half of the world's total population. So let's get started and know what it is all about. A new global oral health status report published by the World Health Organization provides the first ever comprehensive picture of oral disease burden with data profiles for 194 countries, giving unique insights into key areas and markers of oral health that are relevant for decision makers. The report shows that 45% of world's total population, or 3.5 billion people, is suffering from oral diseases. 3 out of every 4 affected people live in low and middle income countries. Global cases of oral diseases have increased by 1 billion over the last 30 years. A clear indication that many people do not have access to prevention and treatment of oral diseases. The most common oral diseases are dental caries, that is tooth decay, severe gum disease, tooth loss, and oral cancers. Untreated dental caries is the single most common condition globally, affecting an estimated 2.5 billion people. Severe gum disease, which is a major cause of total tooth loss, is estimated to affect 1 billion people worldwide. About 380,000 new cases of oral cancers are diagnosed every year. The report underscores the glaring inequalities in access to oral health services, with a huge burden of oral diseases and conditions affecting the most vulnerable and disadvantaged populations. Now let's understand why this is happening. First of all, oral health care requires high expenditures. This often leads to significant financial burden for families, which they tend to avoid. Secondly, the provision of oral health services largely relies on highly specialized providers, using expensive high-tech equipment and materials, and these services are not well integrated with primary healthcare models. Another reason of this issue is poor information and surveillance systems. Apart from that, low priority for public oral health research are major bottleneck to developing more effective oral health interventions and policies. Now, what can we do to improve global oral health quality? Firstly, we will have to adopt a public health approach by addressing common risk factors. We can do so by promoting a well-balanced diet that is low in sugar. We must stop the use of all forms of tobacco, reduce alcohol consumption, and improve access to effective and affordable fluoride toothpaste. You might ask me, what is fluoride toothpaste? Well, in some toothpaste, fluoride is added so it can be applied directly to the teeth to reduce the formation of a sticky plaque on the teeth, which can prevent the swelling of gums and tooth decay. Next, we must start to plan oral health services as part of national health and integrate oral health services in primary health care as part of universal health coverage. In this issue, WHO Director for Non-Communicable Diseases, Dr. Bente Mikkelsen, has said that placing people at the heart of oral health services is critical if we are to achieve the vision of universal health coverage for all individuals and communities by 2030. She also added that this report acts as a starting point by providing baseline information to help countries monitor the progress of implementation, while also providing timely and relevant feedback to decision makers at the national level. That's all for this video. Kindly subscribe to our YouTube channel and follow our social media pages to get regular updates.